important things we need to improve about the healthcare delivery system, and the most important is rising costs, which is a pressure on all of us, including those of us who have insurance. But number two, having said that, I am completely and unalterably opposed to the sort of proposals you've seen from the President administration and their allies in Congress. Let me mention three main reasons I am so completely opposed to those proposals, and three proposals I have been advancing to improve health care. First of all, in terms of the Obama proposals. Number one big concern is so-called government option, and my belief that in a few years this government option would become the dominant option or the only option, and would have government-run health care. That's the last thing I want to discuss. Now, the President says if you have insurance you like, you can keep it. Why do I think that would not be the case under his proposal? Well, there are a lot of reasons, but just let me give you one simple example. In the bill that came out of Senate committee that we're considering in the Senate, there is a brand new first ever mandate that all business, including small business, has to provide health insurance to certain minimum standards. And if they don't, they can choose not to, but then they have to pay a certain penalty to the government. That penalty in the bill is $750 per employee per year. Now, what's the point of that? Well, one point is that the average cost of business to provide health insurance is over $6,000 per employee per year. So what do you think that means? To me, it means that a lot of business under this plan would dump the employees they have now under good coverage and dump them to go on their own, particularly if there is a government option. There was an independent study by a group of experts called the Lewin Group that said this could result in up to 118 million Americans who have coverage now that they're reasonably satisfied could result in their getting dumped. That's not progress, that's moving in the wrong direction. Point number two, cost. All of these proposals have been estimated to cost between $2.2 and $2.4 trillion with a T over 10 years of full implementation. That's an enormous burden and an enormous cost. That's on top of the $1.8 trillion of debt this liberal Congress has already created this year. That's on top of a budget they passed over my objection that doubles that very high level of debt in 5 years and triples it in 10. And those first 2 points lead to my point number three. There would be enormous pressure under that plan to pay for those costs, to somehow cover those costs. And I believe that pressure would lead to exactly what it has led to in countries like Great Britain and Canada, which is delay and denial of care, essentially rationing. And I'm completely opposed to that. We need to deal with cost. We don't need to deal with it by having a government bureaucrat deciding what treatment you can and can't have. And that is absolutely the case. It's not an accident that the 5-year survival rate for women with breast cancer in this country is about 98%. But in Great Britain, where they have the same medical knowledge, it's about 78%. The difference is delay and denial of care, rationing, and I'm completely opposed to that. Now quickly, three things I support. One is association health plans, allowing small businesses to band together nationally across state lines to buy insurance coverage and get a much better deal because there's strength and a better deal in numbers. Second is reimportation of prescription drugs, allowing all of us as Americans to buy safe, cheaper prescription drugs from other countries and thereby lower drug costs in this country, break down the system that allows the big drug companies to charge very different prices in different countries. Of course, we pay the highest prices by far. And the third idea I'm pushing very hard is a much greater focus on preventative medicine and healthy living, and to build in concrete money incentives into all of our plans to encourage us, not mandate us, to encourage us to move in that direction. That's an enormous area where we can save money, particularly if we more effectively deal with big issues like smoking and obesity, which are the two biggest single causes of driving up healthcare costs. So those are some of my ideas. In Congress, all of this is being debated. My biggest goal in the last month has been to make sure that we didn't pass any health care plan until the August recess, which we're in right now, so members could listen to their constituents across America. And we accomplished that first goal. That's really critical because this August recess is an important time for all of us to speak out, make our views known to all senators and members of Congress. I hope you do that, because right when we go back into session the day after Labor Day, this will be front and center. Now let's get to our three expert panelists. Our first panelists, I'll introduce them in turn.